I've grown up in Oklahoma my whole life. Grew up in Coweta. I went to high school there, and then went to Tahlequah, to Northeastern State, to get my degree in Health and Human Performance. After leaving NSU, I went to work for the Cherokee Nation as a health education specialist, and spent 16 years with the Cherokees and worked really in all aspects through the operations of health there. And in 2008, I left the tribe and went to work at Hillcrest in business development as an assistant vice president there. And eventually they offered me a vice president's role, and so I stayed there for up until a month ago. So I've been in this role now for about 30 days. It's been an extremely rewarding last 30 days. The employees and my co-workers have been extremely gracious and welcoming. And so really everything that I've been doing my whole life in my career has been, I think, guiding me into this role. So it's been a really, really good 30 days. You know, I think that my first goal is that I believe that our citizens deserve great access to care. I believe that they deserve great quality of care. And I believe that we should all treat our patients and each other with respect and compassion. So really, those three items is what I want us to make every decision that we make based on how we treat each other, great access to care, and great quality of care. So that will be what I want to bring to the organization as kind of how we guide our system. That's a really big question, because the health deficit has lots and lots of layers. So keeping in mind that that our clinics are funded by the Indian Health Service. The Okmulgee Hospital is not funded by the Indian Health Service. The rehabilitation hospital is not funded by the Indian Health Service. And so when you talk about a deficit, you have to really break down every facility and every program into what causes that deficit. And so one of the things that we're doing is trying to analyze, where do we lose money and where do we make money? And you have to go and approach each one of those areas individually and not paint just a broad picture of the system as a whole. So right now, we're focusing a lot of our time on the hospital, because as one of the newest facilities that the tribe owns, hospitals, you have to manage very, very tightly. And so that's really where we're at with understanding the economics of what's happening in the hospital right now. What we have to do is get really smart at doing what hospitals need to do as a business, which is controlling their expense, maximizing their revenue, designing the services that they can provide locally, and making sure that their money is spent wisely. It is open 5 times a week. We have a provider there 5 days now. We are getting close to having pharmacy there every day. We're doing some analysis with our lab situation to where we're going to have some lab capability every day down there. But once again, since we don't get federal funds for Wetumpka, I need to make sure that that appropriation gets me through to the end of the year. And as I was describing with the hospital, what I don't want to do is go in and spend all of the money that was appropriated to me in 2 months, and I'd be in a situation where I'm in a deficit at Wetumpka. So we're trying to be very smart and very diligent with the money and do it in a way that we can sustain it as we're building it. I think it's going extremely well. We had, I think, some small hitches on Okemah at the beginning of it, and I think that it's coming together nicely. We had a few glitches with the road in Okemah going up to the hospital. I think all of those issues are now almost finalized, and we're going to have that situation resolved very quickly. So the Okemah Hospital is going to be beautiful, and we hopefully will have it open by the end of the year. I mean, I really appreciate you guys taking time to come over and talk to us. I think we're going to do some great things in health over the next year. The National Council and the Chief's leadership and vision of having great health care for our citizens, I couldn't ask for more supportive legislators and administrators than what I get to work with. So I appreciate their leadership and support. They have been overly supportive in our efforts here, and healthcare is important to all of them, and we're going to make this health system hopefully a model of excellence for our citizens.